Welcome back to The Healthline, issues that shape our well-being. I am your host, Dr. Andrea Ault-Brutus. In The Healthline, we provide engaging and informative content on the factors that shape our health and well-being, along with innovative insights that help us gain a better understanding of our ever-evolving, complex healthcare system. In today's episode, I am happy to welcome Dr. Julie Case to The Healthline. Dr. Case is an associate professor in our Speech Language Hearing Sciences Department. Dr. Case is an ASHA certified bilingual speech pathologist with specialization in speech sound disorders and expertise in childhood apraxia of speech, which otherwise known as CAS. She is the director of the Case Speech Production Lab, which studies the clinical management of CAS, in addition to speech motor development in children with CAS and other speech sound disorders. Dr. Case, welcome to The Healthline.
Thank you so much for having me.
So can you tell us more about your background? How did you get started in your field?
My background goes way back to I was a undergrad out of college. I got a job as a Spanish teacher because I was a double major in elementary education in Spanish, so I didn't mean to have that job, but I landed there. And while doing that job, I pursued a master's because I just needed extra information, and I pursued a master's in Spanish. And while I was doing that, I took classes in language acquisition, and through that experience, I realized what I was really interested in was about the mechanism of how do we speak, how do we acquire language, what are elements about language that allow us to communicate these awesome thoughts and ideas we all have. I was also working with tons and tons of kids in this classroom, and I realized I really wanted a more one-to-one relationship. And so I was at a dinner, and I sat next to the school speech language pathologist, and I said, what is it that you do? And that's it. So I did my master's in speech language pathology. I learned about childhood apraxia of speech, or CAS, really sparked an interest. And I got started on this whole fun career.
So can you please explain to our audience what is childhood apraxia of speech, or CAS for short, and the type of work that you do in the Case Speech Production Lab?
So, Andrea, childhood apraxia of speech is a speech disorder when we look at it at the basics. However, in its most technical definition, it's a pediatric motor speech disorder. When people hear that, a lot of times, there are neurological underpinnings, you hear these terms thrown around and people go, oh my gosh, this can't be for a speech pathologist. This is something completely different. So there's been a lot of controversy around it. But at the end of it, childhood apraxia of speech is a speech sound disorder that impacts children, a pediatric motor speech disorder. Now, it's very different than your typical run-of-the-mill speech sound disorder. So often you think of a speech disorder and you think of, a child can't say their S's or their R's, or they say, look at the titty-tat, right? You think of like Tweety Bird speech maybe, right? But childhood apraxia of speech is really unique in that children with CAS will know in their mind, this is the word I want to say. They have these ideas, and their brain has that representation of the word and the sounds associated. But then when the message is sent from the brain to the speech structures to move, there's a breakdown in the transmission of that signal. So it's often described as an inefficiency because one time the movement signal might be move this big, this fast, at this time. But then the next time it might be a different message. Children don't have a clear signal of, what's going to move? How's it going to move? As a result, children may have incredibly impaired speech intelligibility, and they may have very limited output. For some children, that can be a lifelong struggle for them into young adulthood. The positive is that especially the last 20 years, there's been a tremendous amount of research that's come out. That was part of the work I did as a master's student at NYU, a doctoral student as well, clinical work. I got to work with children with CAS clinically. And then now here at Hofstra, being able to continue some of that clinical research to better help this population. Because for so long, people would actually characterize CAS as a disorder with slow response to intervention. So a child has poor intelligibility, they're not responding to therapy, and people would say, well, this is what we see with kids with apraxia. But the problem was we weren't giving the right assessments and the right treatment to know, well, what exactly is it and how do I work with it? It's like if you had a stomach ache and you kept taking Advil. Well, of course it's not going to get better. You're not giving it the right treatment. That's the exciting history of CAS in that we've made so much progress. And in my lab, we've had incredible involvement in different research studies looking at, well, what exactly is CAS? Can we develop some clinical tools so that clinicians can better measure the progress in CAS, better write goals for children with CAS? And what are interventions that can support CAS so that children will make better progress? One study we did, we had 24 community-based clinicians across 20 different states in the U.S. who we trained them in an intervention specific for childhood apraxia of speech. It's called dynamic temporal and tactile cueing, or DTTC, and it's one of the few treatment approaches with research evidence and now mounting, because we just completed a randomized controlled trial testing this approach when administered by clinicians in their own community, not even in the lab. So that's one thing that we've done. Another study, we just enrolled our last child here at Hofstra. We looked at, well, can we bring caregivers into the treatment room? Everyone's going to practice at home. Can we train caregivers to practice better with their children? So that's another trial we've been doing. And then at NYU as well, we're also looking at, well, what are the changes when children get 4 times a week of therapy? What are they based on what we hear, and also measuring their speech movements to say, do they sound better, and are they also objectively moving better using technology that measures speech movements? That's what we've been doing here at the Case Lab, but in combination with this awesome group of collaborators at universities across the country.
Sounds good. And I understand one of the research projects you worked on, you actually received seed money from Hofstra.
Yes.
Can you tell us more? Was that one of the projects you mentioned, or is it a totally different project?
Totally different, Andrea. Okay. And it was one of these moments where you felt your worlds come together. As I mentioned, I started off as a Spanish teacher. And in my career, when I started my master's in speech pathology, it was very geared towards speech-language development, speech-language intervention. But then when I went out in the field, I also did bilingual certification, so I was a bilingual speech pathologist. But then when I did my PhD, my research really just dove into apraxia. And then through the last first 5 years of my research program, it was really just establishing a research program for childhood apraxia of speech. But then with the really generous seed funding from the Dean of Health Sciences, I was able to bring together all my worlds in studying childhood apraxia of speech in bilingual children.
Awesome.
And so this work was done. I was able to use this funding to collect some pilot data. The pilot data was then used to apply for some grants, and I won an award from the American Speech Language Hearing Foundation, which this has just started. We're, in the hiring process to get everything done. And in this award, what we're doing is, as I kind of said, we've made a lot of progress about knowing, well, what is CAS? How do we assess it? How do we treat it, right? But now you have a child who speaks 2 languages. The same behaviors in a English-speaking child, would you see them in a Spanish-speaking child? But what about the system that has both languages together? So that's what this study is doing. And an exciting part, I think, about this study is we're doing all data collection remotely using Zoom and other technology to collect data so that children are in their own homes. Why is this important? This is important because, number one, to find a clinician who knows how to assess and work with CAS, period, is really challenging. It's a really big struggle for families to find a clinician with appropriate training, number one. But then trying to find a clinician with appropriate training in apraxia and a bilingual speaker is even harder. So if we can find a way to say, okay, here's the presentation of this disorder in bilingual children, and here's an approach that you could use at least to get a good assessment, and then to feed, to best inform the clinician that's local, we can reach more kids and hopefully help more kids and families so their children can speak and in both English and Spanish so that, You should never have to abandon your heritage language. You should be able to maintain both.
That's important. Actually, one question I have is just in terms of diagnosing. Like, how can a parent go about getting their child diagnosed with CAS?
So if a parent had concerns about childhood apraxia of speech and they wanted to get the diagnosis, you want to go to a speech language pathologist with training in the assessment, the differential diagnosis of motor speech disorders, or specifically apraxia. This is a really important point. It's often a myth buster. So when I go and I talk about apraxia to the community or SLPs, many will say, oh no, we need a neurologist, we need a pediatrician, because this word neurological pops into the definition. However, it's a speech sound disorder. So the scope of practice really lies within the speech language pathologist with the appropriate training to make a diagnosis. Now, it can be hard to find people with the right training, but there are some really good resources. So, if anybody locally comes to me, I always try to connect them with somebody that I know locally, or if they can, we have a clinic. There's the Salzman Center here at Hofstra, and we've had an awesome collaboration with Alyssa Sandler, one of the supervisors there, a group called Motor Mouths, where parents, if they have concerns of speech sound difficulty or apraxia, this is a student-led, supervised group where children can receive assessment and treatment within this small group setting. But then also there are foundations like the Once Upon a Time Foundation, Child Apraxia Treatment. They do these advanced clinical trainings, and they have a registry on their website of clinicians who have attended. So they would have more training. Apraxia Kids as well is another organization that also has a list of clinicians who have gone through their screening process as well as having experience and knowledge of childhood apraxia of speech.
Thank you for sharing those resources with our audience. I know they really would appreciate that information. Going back to your research, any initial findings you'd like to share with us that you found so far?
Sure. What am I allowed to tell?
Let's see, yes.
Ooh, everything's so hot off the press.
Yes.
It's very exciting. The one study that we just presented at the American Speech Language Hearing Association convention back in November, this was the study where our community-based clinicians administered therapy. And the real question was the difference between twice a week of therapy and 4 times a week of therapy, that if more is better and what the effect of that is. Now, I'm not going to be able to give the answer for that because we're still unpacking and cleaning the data and understanding the variability. But what I can say without any hesitation is that our children, this is to date, there's a couple of other large-scale studies going on, but this is the largest cohort of children with CAS that has ever been studied. As I said, there's a couple other groups that have done this as well, but large scale, prior to this, it's been like 6 kids, 7 kids. But we have 61 children.
Great.
Who completed this phase of treatment. When this motor-based approach, DTTC, or Dynamic Temporal Tactile Cueing, an approach designed by Dr. Edith Strand, who's our fearless leader of so much that we know about apraxia, after this intervention phase, administered by clinicians in their own community, not in a research lab, not in a hospital.
So in the real world.
In the real world,
Yes.
Which is why I'm emphasizing this. We're not, locked away somewhere. That we see robust gains in their speech accuracy from before and after treatment for their practiced words. We see carryover to words that weren't included in practice. When children come back 4 weeks later and then 8 weeks later, so a total of 12 weeks later, they're maintaining these gains. So it's kind of says like, all right, this is an approach that works and it can be done in your community with appropriate training. So now we've got so much data we're trying to understand and unpack so we can give even more information.
That's great. And how long do you plan to follow this cohort of kids?
They're done after 12 weeks.
Okay.
Yeah, after 12 weeks, we no longer are following them. We've kind of had some rumblings, should we try to find them? Because our clinicians will come back and say, you won't even believe this child who was hardly speaking in single words. It's 1 year later, and they're speaking in phrases.
That's great.
So it's exciting because when you interact with parents, in families, so a big part of what we do, because we do have this other study where caregivers are involved, you feel their pain. And to sit across from a parent, and I'm a parent myself, and they look at you and say, is my child ever going to talk? It's like I have chills just thinking about it. of course, I can't say, we can't tell clinicians, you can tell them, yes, of course, but you can say, I have some tools. I've been trained. We know that in children with this profile, we've seen progress, and we're going to do our best to get your child there, and know that there's really good research evidence. So it's exciting.
That's very exciting. And one thing that I appreciate just being here at Hofstra is that, we're always giving our students opportunities to learn and to meet others in the field. And so I understand that Hofstra recently hosted a collaborative conversation on supporting students with
dyspraxia.
Dyspraxia.
Yes.
Thank you. Dyspraxia and apraxia back in December.
Yeah.
Can you tell us more about that event?
This was a really exciting event. So apraxia of speech, what I described about the brain knowing what to say but not sending the right signal to the speech structures to move, it can affect your speech structures, but this concept of apraxia or planning of movement actually can affect your arm movement, your leg movement, your eye movement, the swallow. I mean, it's a movement-based disorder. So dyspraxia really speaks to that idea of generalized difficulty in motor control for whole body movements. And so Bob Gluck in the School of Nursing led this initiative where we had a two-part event last year and this year where we had speakers come to speak about dyspraxia being the motor planning, like the whole body movement disorder, childhood apraxia of speech, which was me, general talking about, well, what is motor planning and praxis and all of these aspects that contribute. In addition to a parent who had a child with dyspraxia or developmental coordination disorder. And this year, we also had an advocate speak, an educational advocate speak about what it takes to support these children, what it means to go to an individualized education plan meeting and advocate and help children get the support they need. And all of our students attended this event. They heard from all of these different perspectives. We had speech language hearing students, we had OT, we had PT, we had nursing, we had PA, we had the School of Ed. And so they all came together, they were mixed up at different tables to listen to these different perspectives and then talk through a case. Now, the interesting part is an interprofessional educational event, these are students who weren't necessarily experts on these disorders. So rather, they had to take their lens to say, well, here's a disorder and I'm not sure what to do. Based on this whole panel, this is where I would start. Where would you start? Because often in the field, our students as health science practitioners come across things and you don't have answers. So it's all about, can I listen to you? Can I see through your perspective? And how can we work together as a team?
And it's good that they're learning this now, how important it is to have those interprofessional connections. And a lot of times I'm imagining that in treating many of these disorders, you would connect with other professionals who could probably help with the treatment plan. Is that the case?
100%. Yeah. I mean, it takes a village.
Yes. Yeah.
It does, because, the children need support, the parents need support, the teachers, the clinicians, and there's so much we still don't know about the interaction between, like a child with childhood apraxia of speech is at a high risk of having literacy difficulties. Other motor planning, such as writing, like a lot of children with CAS will also have fine motor difficulties. Or it could be that, they're meeting their milestones motor-wise. This is what children with dyspraxia say. The doctors are saying their gross motor development is fine, but yet they're tripping over their body and not able to engage and play with their friends on the playground. So you have to have this constant communication and openness to others' perspectives so that you can really put together. I mean, that's what it means to treat the whole child. And you need these different voices and you need them communicating.
This is all terrific. And it's exciting to know the work that you're doing both with our students and our faculty across schools at Hofstra, the kind of work that they're working on. So can you tell us more to wrap up the future in this particular area of research? What do you see coming down the pike in terms of the research in the field?
I will. And if you don't mind, Andrea, I just would love to plug my students,
yes,
the Hofstra students
definitely.
in general. I've had undergraduate, graduate students. They work in my lab. They help collect the data, analyze the data, make sure that the clinician doing the research is supported, has what they need. Interacting with the children, interacting with the parents. I've hired currently the person who's administering all of the assessments and treatment is an alum.
Awesome.
Another one, and she's like, she's my backbone. I often say I wouldn't, and I'm so proud of our school for generating these amazing, strong students. Another one was our data manager for this other huge study that just wrapped up. So our students are awesome. And I just wanted to take a plug for the Hofstra students. And the future, what we're really hoping to do is more research. We have to unpack the variability in this data, understanding, well, who are these kids that respond well to treatment? Who are these kids that aren't responding, and what more can we do with them? Or the kid with CAS who was hardly speaking in words, and now they're speaking in phrases. Well, how do we support them at this next phase? So I think it's, expanding this to reach more children and to also just get more resources out there. We have some new exciting things coming out so that we can reach more people and help more children.
This is great and very exciting, and thank you for the research that you do. It's very important, and even though, and actually this one question I wanted to ask you, what percentage of children may experience childhood apraxia?
CAS?
Yeah.
It's a conversation. We need to do more research to get updated numbers, but the most recent estimates of prevalence are about 1 to 2 per 1,000 children. So it's not highly prevalent, but yet it's also not so rare that, our students who are graduating are going to see a child with CAS if they're working in the pediatric setting.
Yeah. So this is really important work because even though it doesn't have a high prevalence, I'm imagining, therefore, a lot of resources are not put towards it, unfortunately. But it requires a lot of resources that should be put towards it. So.
Which is why I'm so grateful. We have this foundation support from the Once Upon a Time Foundation, the ASH Foundation. We have the, I'm so sorry, there was one other, I think, the SEED funding. The NIH has supported this work as well. Apraxia Kids also has research opportunities. So I just think I'm very lucky to have those resources that have supported this research as well.
Thank you so much for your research and for your work with our students and just for being on our podcast today and sharing your work with us. So thank you so much. This wraps up another episode of The Healthline, Issues That Shape Our Wellbeing. I'd like to thank our studio engineer, Dwali Saikantau, for the great work that you do on our podcast, and also John Mullen for also working on our podcast. I also like to thank WRHU, Radio Hofstra, for their help with the production of this podcast. Lastly, I would also like to thank Hofstra School of Health Sciences for sponsoring this podcast. I am Dr. Andrea Ault-Brutus, and thank you for listening. Have a great day.